In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now we're discussing making dentistry more affordable. Now, we did a survey as part of National Smile Month, and that took opinions from thousands of people all over the country. 40% said that they will not go to the dentist because it is too expensive. With a rise of cost in living, that's even more on our minds where our money goes. And if you don't necessarily view the dentist as a necessary thing, it's probably something that you will just, put off for now. My teeth are fine. My teeth are fine. Don't need it. But actually, we need to really look at why it is the price it is, make it more affordable for people to access, so that people aren't skipping out on this really essential part of their health.
Yeah, absolutely. And I think it is incredibly sad that people put it to the back because of the cost, which kind of is counterproductive, because the less often you go, the more you need doing when you go, and the more costly it's going to be. So, ideally, we should be making the cost of a checkup a reasonable amount. The contract as it stands is a band charge, so you pay exactly the same for having one filling as you would for having 15. So it's expensive for one filling, but it's really cheap if you're having 15. So that really doesn't make it particularly fair across the board, and that is quite discriminatory between somebody who's looked after their teeth well and perhaps has a chipped tooth or a piece of filling comes out. They are charged a lot more than somebody who may not have been for a long time. So it doesn't work, and we've said this before, the contract doesn't work. It needs to be fairer. Now, the price of these the band charges go up every 1st of April. It doesn't match inflation. They go up much faster than other prices. So yes, we're looking at £300 plus for a band 3 course of treatment. So that is anything that requires laboratory work, basically. So that could be a denture with one tooth on it, or it could be full set of upper and lower dentures. So again, there's an anomaly with that band as well as the others. So it doesn't make it fair, and it makes it expensive for people, especially if you're a family. If you've got mother and father, obviously if your children are under 18, then they're going to be free. But often we're supporting children who are studying, but as soon as they reach their 19th birthday, they pay for their dental treatment, unless they can claim an exemption. So a family of 4, if you've got 2 kids at college or university, it's going to be bank and mum and dad that are paying for their dental treatment as well. So that could be incredibly expensive, even if it's once a year. It's a lot of money to budget for. So we need to have a look again about how much people are charged for NHS dental care, and make it fairer. I mean, we can't talk about private dentistry. Private dentistry, the cost is set by the dentist, so that is up to them what they charge. But yeah, NHS charges are set by the government.
Yeah.
So we need to make it so that people are encouraged to go to the dentist, but they're also incentivized for looking after their teeth. So rather than being penalized because they only need one filling, we want to incentivize them to look after their teeth. So if they need one filling, it's not going to cost them the same as if they hadn't been for years. And that will make it much fairer. We've got so many other things to pay for. The cost of living is huge. We've got massive bills, coming in left, right, and centre for everything. It is something that is very, very easy to push to the back. And I would hate for people to do that, because it's just storing up problems for the future. And whilst I totally understand if it's a difference between, buying your kids new shoes for school or whatever, I know what I would do.
Me too.
But it's a shame that we have to make the choice. We should be able to do both.
Yeah. And it's the same with anything. We can take any subject under the sun and argue about the price, right?
Yeah.
But health is a little bit more of a squiggly line. And yeah, I think it's an important point about being fairer, because it's not fair for someone who has been very careful and yet has had an accident and had their tooth knocked out to pay the same fee as someone who has been very uncareful and just not taking care of themselves. It's, it's a tricky, 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 tricky.
It is very tricky. And, whilst we know that the most, the people deemed most needy, in inverted commas, do get free dental treatment, there are automatic exemptions. As we say, there are exemptions that you can claim for when you filled in the 80-page booklet or whatever it is. You can get exemptions towards dental care, but they draw a line, and that fine line sometimes is unfair, because it just, it will be, one person earns £1 more than the line that they've drawn, so they don't get free dental treatment. And I know the line has to be drawn somewhere. I do totally understand that, but things need to be that we're like, okay, well, we're not exempt from it, but that's okay, because the NHS, obviously the dental treatment is subsidized, but it needs to be in a fairer way.
And it couldn't be put any more plainly than that. Likewise with all of the podcasts that we've put out this week in the run up to the election. By the time you're listening to this, if you're listening to it as it goes out, the election's tomorrow. So I hope that you keep all of this in mind. Have a little look at your local councillors and what they want to do to improve oral health in your area. If it's not even mentioned, I guess that's telling enough. But just keep it in mind when you make your vote coming up to polling day. Oral health is a vital role in all health, and we need to keep it more in the front of our mind when we make big decisions like this.
Absolutely. And I think we the 10 points that we've put down there are the things that jumped out at us. Obviously there are many, many more points that we would love to get into any government's manifesto, but let's start with this.
Let's make a start. When we know who is in number 10 at the end of the week, I might come back. I might come back and talk a bit more.
You never know.
That's us for now. Tomorrow is polling day, and I hope that you'll keep these discussions in mind as you go and make that very important call. This, of course, is just the beginning of a conversation about oral health in the UK. However, everything on this list is something policymakers need to keep in mind.